So this is a summary and critique of an article for an evidence-based care project in a nursing research and evidence course at Queen's University of Charlotte. Our group is using evidence-based research to evaluate if magnet hospitals, when compared to non-magnet hospitals, yield improvement in nurse retention and job satisfaction. This particular article supports this claim that indeed magnet hospitals do achieve this, and also it shines light on implications for future research in this area. The article is titled Characteristics of the Work Environment of Magnet Hospitals and Job Satisfaction Among Nurses in Japan, a cross-sectional study using multi-level analysis. The author is a professor in the Department of Nursing at Hyogo University of Health Sciences in Japan. The study was supported by a grant for scientific research from the Ministry of Labor and Welfare in Japan in 2011, and approval was given from the Institutional Ethics Committee at Hyogo University. To prepare the foundation for the purpose of this study, I would like to give some introductory and background information. When the American Nurses Credentialing Center established the recognition of magnet status among hospitals in the early 1990s, it really sparked international interest because there was significant research that proved this model was successful in retaining nurses and sustaining low turnover due to nurse satisfaction. Hospital administrators and healthcare researchers took notice of this. At the time of this study's publication, which was November of 2012, the recognition of magnet status had expanded internationally, and there were 395 hospitals in the world who had earned this status. Now, Japan has its own unique reasons for being interested in this model. A neat fact is that people of Japan have the greatest life expectancy in the world. This is exceptional, but at the same time, it ultimately results in a huge aging population. According to the Ministry of Health, Labor, and Welfare in Japan, the demand for nurses overwhelms the supply. This problem is the driving force for hospital administrators and researchers to find ways to maintain and build their nursing workforce. They recognize the future supply of nurses and the retention of nurses is essential to sustaining high-quality patient care. The problem highlighted throughout this article is not only the supply and demand of nurses, but also the evidence supporting the magnet model. I feel these researchers want to encourage more conclusive studies on the magnet model in order to spark the importance of the magnet status in Japan like it is in the United States. The purpose of this study was to ask, is there sufficient evidence that striving for magnet recognition would really contribute to retention of nurses in Japanese hospitals? And also, is the current research and literature conclusive in multi-level analysis? And if so, can we persuade and influence future researchers to take a closer look at varying degrees of satisfaction on both the individual and unit level? The article has excellent evidence-based resources supporting their study. All were relevant, reviewed, and the majority was published within 5 years of this study. The conclusions of the literature showed that magnet hospitals had significantly higher job satisfaction, lower turnover rates, less reports of burnout, and more positive nursing perceptions of patient care and safety. Essentially, nurses within these magnet hospitals report that they feel more supported and feel as though they deliver better patient care. After bringing forth these previous studies, there is a noticeable theme throughout this article that the authors wanted to get more specific. Now, there are no hospitals in Japan that have actually applied for magnet recognition, but 2 valuable studies have been conducted to test the effect of magnet hospital characteristics. From in-depth research of the magnet model, researchers were able to develop a version that mirrors the magnet model, which is called the Practice Environment Scale of the Nursing Work Index, PES-NWI. The researchers examined the effects of PES-NWI model implementation in hospitals, and the results definitely proved that these hospitals had much greater job satisfaction among the nurses. The authors built their hypothesis and research questions upon this proven concept, and they wanted to determine if there is a more drastic improvement on an individual level or unit level, or if they were affected the same. So they started their research study in August 2011. 4 hospitals who were PES NWI recognized agreed to participate in the study. And if you remember, this PES NWI is essentially the magnet status version in Japan. 3 of the hospitals were general hospitals, and 1 was a hospital mainly for long-term nursing care. The surveys were distributed to all nurses in the participating hospitals, and there was a total of 469 nurses throughout 21 different wards. The nurses were instructed to complete and return the questionnaire to the researcher in a sealed envelope if they wished to participate. 425 nurses actually returned the questionnaire, which was 91% participation, but the researchers had to exclude 52 of those due to incompletion. There were 373 surveys in all that were analyzed for this study. The participants were not asked to sign consent forms because their completion and return of the questionnaire constituted implied consent. The basic inclusion criteria was the participant had to be a nurse within a magnet recognized or practice environment scale of the Nursing Work Index healthcare organization and who completed the survey in full. Exclusion data included in a non-nursing field, in a non-magnet hospital, in management, or who did not complete the entire survey. This study incorporated a descriptive research design. It was a cross-sectional study because there was only one interaction with this sample. The researchers used non-random convenience sampling methodology. Although this may be criticized among researchers, the sample population was highly indicative of these hospitals, and because 373 of the 469 nurses in this hospital gave pertinent and analyzable data. I feel it would be considered sample biased or non-reliable if only certain shifts or departments were surveyed, but this was not the case. The entire nursing staff was given questionnaires. Data was collected on the participants' demographic information, sex, age, marital status, and education level. Employment data was also used. Hours worked, typical frequency of days off per month, and tenure. The data from these questions revealed that the demographics were 96% were female, 96% had vocational school or college degrees in nursing, 64% were married, 15% worked more than 50 hours per week, and that same 15% worked 40 hours of overtime per month. These demographic and employment characteristics served as the control variables, and the objective was to measure job satisfaction among these nurses within the work environments. So this measure is the dependent variable, and the characteristics of the magnet status, or PES NWI, is the independent variables. To assess these characteristics, 31 items of magnet hospitals were comprised into the following 5 subscales. 1. Involvement of staff nurses in the internal administration and governance of the hospital. 2. Quality care nursing foundation and support. 3. Confidence in nurse managers' leadership and guidance. 4. Staffing and resource adequacy. 5. Teamwork and interdisciplinary relationships. The question had 4 possible responses: totally agree, agree, disagree, and totally disagree. The Likert scale was used to score, using 1 through 4. Job satisfaction was determined by a 15-item scale, measuring the degree of satisfaction regarding working conditions like positive interdisciplinary teams, career opportunity, and compensation. These satisfactions had the following response choices: very satisfied, satisfied, neutral, dissatisfied, and very dissatisfied. Each item was scored using a Likert scale, 1 through 5. So the analysis. The statistics of subscales of the PES, NWI, and the job satisfaction scales were calculated. The correlation coefficients between job satisfaction and dependent variables were also calculated and analyzed. There were 3 analytical models that were used to see which was a better indicator. Model 1 scored nurse job satisfaction based on individual level variables being added into the equation as independent variables. So these controlled for sex, age, marital status, frequency of work days, and days off. Model 2 used the magnet model characteristics as the independent variable, and they were calculated in at that time. Model 3 integrated both individual and level and ward level variables when calculating and scoring job satisfaction. The researchers developed the following findings. The greatest correlation to job satisfaction among individuals and units were for staffing and resource adequacy. Individual level results indicated significant job satisfaction with all subscales except nurse participation in hospital administration. So essentially, results indicate that this concept is not as valuable to nurses on an individual level as the others are. Ward level values indicate the more important subscale is nurse participation in hospital administration and staffing resource adequacy. Lastly, but most prominent, is the result that the Model 3, the full model, which used multi-level analysis, was the most appropriate model. The authors noted the following conclusions. Number 1, full models in which results are examined at the individual and ward level is the most appropriate model to use when researching the effects of the magnet model. There is a significantly greater relationship with job satisfaction and the magnet status values among the ward level than the individual level. And all concepts termed subscales, except nurse participation in hospital administration, shows definite improvement of job satisfaction. The authors do acknowledge that limitations were present. They discuss that results may be unique to these participants due to only using 4 hospitals. They also pointed out that the units observed were relatively small and the future studies should use larger units. Also, the cross-sectional design was appropriate for this single study, but longitudinal studies would be helpful in the future. It is important to understand that this article is purposeful in guiding future research. The study ultimately revealed that the individual level and unit level analysis is informative when comparing magnet and non-magnet hospitals. So essentially, their hypothesis was supported. This is the conclusion of the article summary and critique. Thank you so much for listening.